Dr. Merv at AKLADIOUS and Associates, a solo practice located in Auburn, caters to a highly multicultural community. Dr. AKLADIOUS has integrated a strong asthma management plan to further the primary health requirements of her region. The mismanagement of asthma within the community prompted the integration of a digital peak flow system, providing patients with asthma care plans and continual management undertaken by both the GP and practice nurse. Levels of asthma-related issues have been reduced substantially, creating a strong environment of integrated primary health care.
I am Merv at AKLADIOUS. I am a general practitioner and work as a solo practitioner since 1977. I've been doing general practice since 1991 in Australia and back home for 15 years. I have my special interest in pediatrics and young families, and mostly I do diabetes care, asthma, and women's health. We established this clinic since 1996.
My name is Michelle. I work as a practice nurse with Dr. AKLADIOUS. I work here as a part-time. Normally I'm here in the afternoon, and in the morning because I still work in the hospital. I
started by myself. I'm still by myself. And we built it up until a stage when we felt that we had enough and we need to look more after our patients so that we concentrate on their general health. And we decided to have this as completely no new patients except for certain conditions. And it's running very well, so my patients' family history now goes back to 16 years now. We have mostly Arabic speaking, but still we have Anglo-Saxon, and we have Somalian, we have Italians, Greek, so all nationalities, because Auburn is really a multicultural.
Being with the practice manager here in the clinic, I work mainly with the patients. Some days I book patients for immunization, asthma, or diabetes. Some days, if I don't have patients, or if I have a free time, I do all the care plans and I just check on patients that are waiting outside. With the doctor, I work closely with the doctor because there's only one GP here with Dr. AKLADIOUS and me as a practice nurse. So what we'll do with the patients, with asthma, normally I book patients with asthma on Monday or Tuesday. I recall them, I call them and then see how they are with their asthma, if they want them to get checked up or their spirometry or how are they doing. If they want some advices or education, they can come in and I can book them. Some days I book immunization for the babies and some vaccine for the adult too. And some days we do the diabetes. Yes, so we have a lot of things here. And to review patients. So, because especially if they're not controlled with their diabetes or their asthma, so we tell them to come here every 3 months, so just to check on them. So I book them and then we just review what their plan is, because we normally give them a plan, like a care plan or an asthma plan, and then I just review them and help them, give them support or anything that they need. One of the practice or that we manage here in our practice is the asthma. So with the asthma, I normally get them all in the medical director and then I'll put it as a recall. So everyone who are diagnosed with asthma or who has puffer that they're taking, I put them on recall and then call them and just call them and see how they're going with the asthma. If a lot of the patients who are on the younger generation, they want their asthma to get checked. So I ask them, oh, how are you with your asthma? Are you taking your puffer? And then I'll ask the mom or the parents or the carer to get here in the clinic and then check on the spirometry or how their lungs is doing. Yeah, and then I can refer them to the Dr. AKLADIOUS if they're not controlled or if we need to change their puffer.
The asthma initiative has started, I would say, more than 10 years. We employed a practice nurse and it was really very successful. This was a real encouragement. We got a new, high-tech spirometer, which is very simple, easy, and it covered its cost very quickly, so there was no problem. And then the clinic could run for, say, every week we could see about 20 patients or so. In 3 months, we could have seen about 80% of our patients. And it was really a high mark that we have done. And all the patients, after the nurse normally does this, and I'll see them, follow them, we give them the asthma management plan. They have, we use the peak flow meter and we look for the best reading, and accordingly we give them the plan. Especially with school kids, we give them the plan. They have to give it to the teachers there or the people responsible, so that they know how to act when the child has the asthma. So it was really nice and organized, and everything was going smoothly. If the spirometry reading was not very good, we normally reschedule them for asthma review in 3 months. If everything going fine and the normal spirometry, it gives us the chart. And the beauty of this, especially this kit, it gives us the information into the patient's file in medical director. So we don't need to copy, we don't need to paste, we don't need to scan. It goes through. When the patient come from the nurse and I see them, I can go and follow with them the readings and just give them the more advice that we possibly do. When they come for the review and they do it, at least they know how to follow the instructions, how they do it. They bring their medication with them. When we had the medical company giving us, supporting us with the nurse, they brought us a lot of peak flow meters, and thank you for them. We gave it to them, so the patient at home, if they don't feel well, or even during, like routinely, they do the peak flow meter, so they bring us the readings. So they know when they are not feeling well, and they come back. So we give them the numbers to call when they need any support. Whenever we write any preventer, in the medical director, we have a window that comes, do you want to enroll the patient in the Asthma Foundation support? And when we say yes, or we print it out, we send them, or they call them and give them all the support they need. So, and they're different languages, so we don't have a problem at all. With this new kit, it's so easy. I know the mouthpiece, they are disposable and they cost us a couple of dollars per patient, but this doesn't make any problem. And the patients really are very reliable, and they come according, like if we make an appointment for them, we can say 95% come in time.
One of the chart or the brochure that WentWest gave us, it's part of it's education asthma. It's a cycle of care. So what it has is, there's a trigger or the symptoms. It tells everything, if your symptoms, if you're unwell, or if you're getting worse. So with patients, I always give them the brochure so that they can track down if they're feeling unwell or not, or so they'll be educated with what symptoms they're having. So at the back, there's a plan that we can write down what triggers their asthma, because almost always that's all the common triggers. So you have to lessen the triggers so that the attack will not, there's no asthma attack. So at the back, you can write down, you can plan what's the trigger, and then when they come here again, I'll always tell them to bring their asthma plan so we can review what have they done or how are we going with your asthma. With the WentWest or the division, they always help us with the support with their program. If ever we have anything that's asthma or diabetes, so let's say asthma, we can ask them for any material or information that they have, and they can send it to us, or some puffer, or we need some education like the paper brochure for asthma that we can give to the patients for just an education. Yeah, so they help us out with all those things.
WentWest, if I talk from now till tomorrow, I can't really explain how much they supported us from day one in every field. technically, computer-wise, all the support, all the basic stuff, even with the nursing, to look for the nurse, they worked hard. They always try to give us the list of patients, and if they can do much, they come and they even call and say if there is anything we can help with you. So with the asthma, they were really coming. We have the pen cat program. They come and they do it themselves, not that just tell us how to use the system. And then shortcuts, everything. Really, we cannot reward them. WentWest support us. Diabetes, asthma, as we mentioned, all chronic problems. If we need anything, they will be beside us. And I really have to thank them because they always think of me. I don't know, I'm sure they think of everybody, but whenever they have any pilot program, I am involved in it. So they keep me always ahead. And they are just a phone call away, I tell you honestly. I just call and I find them sometimes. If they're in the area, they just walk in. You can't believe it. They are very, very, very professional.
What I'm most positive about working here is with the promotion of health. That's a very number one. Patients who are in emergency, it's all preventable. It's all so we can prevent things or people who go to the emergency by just doing this practice. So especially in this practice, because we are family, more on family, we don't accept any new ones. So we already know who our patients are. We already know their history, what diseases they have, so we can more control it efficiently. Yeah, and then we can lower the numbers to go to the emergency in the hospital. Yeah.
My goal in the future, I just want to keep on and improve and promote all the preventive measures, that by doing all the primary care for the patient, I think everybody will be awareness even. The awareness is very important.